Good morning out there, YouTube land, and welcome to today's version of Hanging with Dr. Cooper. I am Dr. William Cooper, your host, and I certainly appreciate you all being here on the show. As you all know, we have four objectives in this show. It's motivation, inspiration, information, education, and transformation. What we like to see is see you do better in the long run for yourself. So we provide you with that information by talking to some of the world's top doctors, as well as medical experts and subject matter experts on various topics. So welcome today. This is Sunday, March the 21st, 2021, and we are certainly glad that you are here. I want to ask you all to join me in welcoming my good friend, my doctor, and also my fraternity brother of the venerable Theta Epsilon, Brown University, 590, Marc Harrigan. Welcome, Mark, to the show.
Thank you, man. Thank you for having me. Cool.
Absolutely. All right. Thank you, my brother. Thank you so much for being here. So, Mark, one of the things that we like to do on this show, we don't read long bios because I think that's an advertisement. Everybody has a story. So we'd like for you to tell us your story. Where'd you come from? What motivated you to go into medicine, and some of the things that have inspired you along the way?
Oh, good, man. Well, first of all, thanks for having me this morning, man. It's good to be here with you, and I appreciate the opportunity to chat with you and everybody in TV land, YouTube TV land, and Facebook Live this morning. So about me, I don't even know where to begin, man. So I grew up mostly in New York, Long Island. As a lot of people know, and as you know, my family's from the Caribbean, particularly the Virgin Islands, and I spent a lot of time there growing up as well. In fact, probably being one of the only people in my family having been born in the continental United States and having sort of a rich Caribbean family history. There's a lot of pride in being a Caribbean American in this country that was instilled in me by not only my parents, but my grandparents as well. The hard work ethic is at the top of the priority list. I could truly say from as young as I can remember. But that said, man, my parents have always afforded me the opportunity to have the best educational experiences available. And as a result, I attended Brown University as an undergraduate, went on to the University of Virginia School of Medicine, and decided on a career in family medicine. And a lot of people don't know this. I was actually contemplating a career in orthopedics, and decided not to do orthopedics primarily because I felt that I was better suited to be in front of people on a regular basis, to be able to help them with chronic illnesses on a concurring basis, which I felt like that was my strength, as opposed to operative medicine, which is what a career in orthopedics would have been, which I probably would have been very happy with as well. But at the end of the day, I didn't feel like that really fit my personality.
Got it. Let me ask you this. You forgot one key thing there. You played football. Tell me about that.
I did. I played some college football for about a year and a half at Brown University, and saw that was quickly going nowhere because that was starting to interfere not only with my academic studies, but some of my social development at Brown as well.
I get it.
A lot of people don't know this, man. Anytime you play sports at any level, at any college institution, man, it really takes away from the true experience of college life. If you're not in sort of the rank and file of everyday student life as a student athlete, and so it became very difficult to find that balance. And of course, as you know, man, along the way, ran into Omega Psi Phi in college, and that was
how you said that I ran into
Omega Psi Phi, man, and
great way to put it.
Try not to let me in, but I got in.
I hear you. I hear you, my brother. We're certainly, I'm sure that's been a certainly fulfilling thing for a lot of us. So, Mark, what was that one thing, would you say? And let me just give some shout outs. My mother-in-law's here. My wife is here. Patrice Brown, all my good friends, Jimmy Durham. I see you, Roland Jackson. I'm trying to call out everybody that I can. Leon Haley is here, Mark. You're a good friend and our good friend and fraternity brother. So you all are on with Hanging with Dr. Cooper today. My guest is Dr. Marc Harrigan, the CEO of Concierge Medicine of Buckhead in Atlanta, Georgia. My doctor, my friend, my fraternity brother. And we're just talking about his background. And so, Mark, let me ask you this. What was that one thing, if you had to point to that one thing and said, you know what, I get the family practice and, the thought about going to orthopedics, but what was it that one thing, if we backed you up and said, what was that one thing that said, I'm going into medicine? As a young African-American male, smart, athletic, you had the entire world in front of you. And this is going to get into a conversation we'll have later about Black men in medicine. But tell me that one thing that you said, you know what, I got to do this. This is me. This is my life's passion.
Man, I think there was a series of just, experiences both in high school and in college that sort of, got me on the path to where I am right now. I went to boarding school actually in Connecticut, and I was part of a program called the Better Chance ABC, and some people may know about that. It's a program that actually assists folks that come from African American or minority backgrounds and assists them in getting into better secondary institutions. And there was a summer program that I attended at MIT in the summer of my junior year called Careers in Medicine, and I'll never forget that because that was sort of one of the key things that allowed me to really believe that having a career in medicine was possible. It took place in Boston, and going on rounds with doctors at Mass General, attending clinics and things of that nature, just really, really heightened my interest. But one of the things that I've always sort of, held closely was how people really felt about their doctors and examining those relationships in terms of what they meant to people. Because I always had, a keen interest in asking people how their experience was when they went to the doctor and why that was so important. And, back in the 80s, man, being a doctor was like a really, really big deal.
That's a big deal. Yeah.
And particularly for African Americans, which I did not see a lot of, which further inspired me to want to do that. Then I got to Brown, and Brown University, and for those that went to Brown, and Leon can probably attest to this, was a very tight-knit community, particularly for those who were in pre-med. And Brown was very intentional about promoting the interests of minority students who were interested in medicine. There was a very strong pre-medical society group, Black pre-med society group at Brown. And ultimately, the goal of the Black pre-med society was to support one another in our goals to become doctors. I can't recall anyone who was ever a part of the Black pre-med society at Brown that did not become a doctor.
Oh, wow. Wow.
And so it was really, really strong. It was a brother-sister network that, hey, this is how you pass the MCAT. These are the classes you need to take while you're here at Brown, so on and so forth. These are the professors you need to know. This is who you need to talk to in terms of helping with your medical school admission. And one name I do need to mention, brother Levi Adams, man. He was the dean of, I forget the specific title, but he was in biomedical sciences at Brown. But most importantly, he was very instrumental in getting a lot of African-American students from Brown into medical schools.
Right.
And anybody who's ever attended Brown and was pre-med knows exactly who I'm talking about. And so it was a situation whereas none of us would allow each other to fail. And that's what it was, man. It was a support network.
Got it. That's very important because, as you know, a few years ago, about 7 years ago, AAMC put out the Altering the Course report on African-American males going into medical school. And our frat brother, Cedric Bright, certainly had a very instrumental a role in that report. I see Arthur Raines out there. Art will be glad to know that you at one point in life considered orthopedic surgery. Our orthopedic surgeon, Arthur Raines, is in the house. I'm talking to Dr. Marc Harrigan, my guest here here today on Hanging with Dr. Cooper. We're just talking about Dr. Harrigan's background and some of the things that motivated him to go into medicine. So you left Brown, you went to University of Virginia. Tell us what that experience as a resident was like, and then how you ended up in hot Atlanta, of all places.
Well, Virginia was interesting, man. It was a great place to go to school. The training, I can never complain about. Obviously being, an African-American male, a predominantly white institution, and then, rounds as a, third-year medical student, fourth-year medical student, always had some challenges. But what could not kill me made me stronger, and allowed me to be able to, formulate the type of style that I have now, which allows me to be able to deliver great patient care. I did my training at the Medical College of Virginia, and trained in Newport News, Virginia, in family medicine. And from there, went on and joined an employed big group called Centara Medical Group in Virginia. Did that for about 5 or 6 years. And then I've been here in Atlanta ever since, and that's been 16 years ago. So it's been fantastic, man. And this is important, man, because I got here to Atlanta and essentially started a practice from nothing, and essentially developed a reputation over time and grew my individual practice at Piedmont as an employed physician to almost 4,000 patients. And that, took some time, but that doesn't happen without, providing good care and having, good reputation. But having 4,000 patients, if you can imagine that for a minute, and being able to provide quality care for, 4,000 people, not all at once, but over a period of time, became very, very taxing. Medicine today, from a primary care perspective, it became about how many patients that you can see in a day, as opposed to the quality that you can provide. And so imagine seeing 25, 30 patients a day in the span of 7 hours. That means that each patient is probably only going to get a good 10 to 15 minutes of your time.
Yeah, that's the reality. Yeah, that's the reality.
It became, very non-satisfying to me, and unfortunately non-satisfying to my patients as well, because what it created was an incredible pent-up demand to see your doctor that you identify with, but there was no space to do it. And so I found myself having 3-4 month waiting period for people just to get to see me.
Yeah.
And I was starting to hear about it. Over and over again, for years at a time. And it created a tremendous amount of stress for me.
Yeah, I would imagine that, that you're kind of a victim of your own success based on the way that healthcare is designed today, even in some ways. So you moved and transitioned at some point into concierge medicine. Tell us about that transition. Tell us a little bit about what that means to you and what that means also for patients. So
it was interesting. So I think, as you probably remember, I ascended to some of the higher ranks of leadership at Piedmont in terms of physician leadership. So I became a medical director, and through that experience, my administrative experience, I was really beginning to understand the business of medicine and all facets of it. And so, concierge medicine was something that I sort of worked with in my leadership capacity at Piedmont, and not really understanding what it was. I first heard the concept, I want to say maybe 10 years ago. And it was introduced to me as a vehicle for which physicians who are getting towards the end of their career usually transition to, as a way of quote unquote slowing down. And I never really took the time to really begin to understand it until I had reached that point of becoming a little bit more burnt out in my own personal career, and started thinking about what the next steps were going to look like for me for the next 20 years of my career. And so I toyed with going into a career in administrative medicine, which would mean executive vice president, CMO, CEO, which also would mean having to potentially move my family around every few years, which was not an attractive option for me, and didn't allow me the opportunity to really keep my hands in the cookie jar of being able to practice medicine, which is something I really always wanted to do and and love to do. And so I started toying with the idea of looking at a career in concierge medicine. And so for those who don't know what that is, it's really just a terminology, a very fancy way of saying personalized medicine for a smaller practice. And, for African American, male physicians, it's oftentimes a very tough transition because, as you can imagine, here in Atlanta, my patient practice was very, very mixed from a socioeconomic standpoint. And so, I have, having folks from every sort of economic, rung on the ladder, every social rung on the ladder, and so on and so forth. You're not sure what you're going to end up getting when you transition even to a private individualized practice. And concierge medicine is a practice whereas individual patients pay an annual membership fee to be a part of a small practice. And some people may ask, what do you get in return for that fee? Well, what you get is I have now a practice that went from 4,000 now to 300, and which will probably max out somewhere around 400 to 450. But what that turns into is increased quality time that I'm able to spend with my patients. On average, my office visits have gone from 10 to 15 minutes a piece now to, on average, 45 minutes to an hour and a half. And so my 25 to 30, or even 35 patient day has gone to, a maximum of maybe 5 or 6 per day.
Right.
But always having same day or next day appointments available, always having time to spend with my patients, not only in office, but after hours, weekends, anytime that patients need me, they are able to get me. Being in a personalized care practice affords you the opportunity to be able to address some of the major frustrations that people have with primary care right now. And we can talk about all of those. From not getting an appointment, having to sit in a crowded waiting room, particularly in COVID, not being able to access a doctor if you potentially have COVID symptoms, or for any of those matters, or not necessarily feeling like your doctor is listening to you. One of the things that I pride myself on is the preventative piece of the practice, which is where I think a lot of us miss the boat.
Let me interrupt you there, Mark. We're going to get into that because I really want you to dig down into that issue for us. So there's a lot of terminology out there that I think people need to really understand. So we talked about the concierge. We talked about, now there's this whole concept of direct primary care. So how does that differ from concierge medicine? And before you answer that, I just want to say hello to my friends out there: Travis Page, Quentin Tooks, R. Raines, Ernest Greer, my boy, D. Banks. I see you, Roosevelt Giles, J.W. Scales, Ryan Hempfield, Montez. Thank you all so much for joining us. Regina, Mixon Bates, everybody that's out there in YouTube land, thank you so much. We really appreciate your support. You're hanging with Dr. Cooper, and my guest today is Dr. Marc Harrigan, and we are discussing concierge medicine. And so, Mark, give us a little bit of a compare and contrast to concierge medicine, and you said it's more about personalized care, and direct primary care. And I guess one of the things when I first heard about the concept of concierge medicine years ago was the idea of access. What are we doing? I mean, how can just everybody do this? I when I think about concierge, I'm going to go to concierge, it's going to be something VIP or something of that nature. So kind of give us a little bit of understanding of what that means and what, essentially everyone who's listening to this can participate in when it comes to direct primary care versus concierge care.
So I'll talk about concierge medicine very briefly. So historically, the concept of concierge medicine came about probably in 1996. I believe the first concierge practice was started in Seattle by two doctors who essentially were experiencing some of the same frustrations that many of us who make this transition into concierge medicine felt. And they started it with roughly just a few families, and each of those families to pay to be in their practice, if you can believe this or not, paid anywhere from $15,000 to $20,000 a year.
Yeah.
In this first concierge practice. And various offshoots of that have developed throughout the last few years in multiple states around the country. So very specifically, what concierge or personalized medicine means is that you buy into a membership into a practice with a physician that you know well and trust, who is going to handle essentially every medical need from a primary care standpoint, ranging from most importantly, prevention on an annual basis, but spending more time specifically with every detail of preventative medicine, ranging from social history, family history, getting into all the nuances of genetics, cancer screenings, cardiovascular screenings, which is what I'm really, really big on, particularly endocrinological diseases, diabetes, elevated blood pressure, obviously hyperlipidemia, and really getting to the heart of those issues before they become a problem.
Right.
And I'll tell you, two quick anecdotal stories, being that I've been able to spend a significant amount of quality time with each of my patients over the last several years, I have been able to detect significant heart disease, asymptomatic, in 3 patients that ended up going and having corrective surgery for undiagnosed significant 3-vessel heart disease. And as you well know, Coop, how significant that is. A lot of people
Sure.
walk around sometimes without the symptoms. And how we were able to figure that out was we were able to take into account significant risk factors, advance cardiological testing, which I am able to do because I now have the time to do it and study it. And also working in close proximity with various specialists, which is another sort of benefit of being in a concierge practice. I've got very close relationships with a number of specialists here in town that I am able to pick up the phone and call them at a moment's notice, and they are able to assist and help. One, as you well know, Dr. David Montgomery, who was on your show.
Our good friend. Right.
Absolutely. And so concierge medicine affords you the opportunity to do that. People often wonder, okay, am I able to use my insurance in concierge medicine?
Your high deductible plan. Can that be applied?
Plans, right. So high deductible plans, even with a high deductible, any insurance, you are allowed to have an annual preventative medicine visit with your physician without cost. Now, where the deductible comes in is potentially for follow-up visits, medicines, outpatient diagnostics, and things of that nature. But positioned appropriately, we are able to assist in being able to bring the cost of those down. And so we are able to explore different cost measures that work within a patient's budget so that the burdensome cost of having a high deductible plan isn't that burdensome.
Got it. Let me ask you this, Mark.
Yeah, go ahead.
Yeah, let me ask you this, because there's a question from the crowd from Dr. Rains, which I think is very, very important for our audience to understand, that you still accept pretty much every insurance plan out there. Is that correct?
I do.
Yeah.
It's important because Lord forbid you ever have to end up in the hospital. You would want to have some level of insurance to cover any hospitalizations. But more importantly, to keep you out of the hospital, there are some diagnostic things that need to be done from a preventative standpoint, which you probably do require insurance to have. For instance, my female patients who require mammograms on an annual basis, some may even require bone density studies, things of that nature that insurance do cover under preventative studies. And for my male patients, it can run the gamut as well. Yeah. So it's important to have that. Now, you asked a question about direct primary care and what that is.
I did. Yeah, we moved on, but yeah, go ahead. Yeah, go ahead. Yeah.
Oh, the direct primary care piece, it's not necessarily concierge medicine. It's direct primary care practices are quote unquote membership practices as well, but they specifically just focus on sort of quick primary care things that come up. And so direct primary care practices are a la carte practices where you do not use insurance, and you sort of pay as you go primary care for runny noses, urinary tract infections, very simple and mundane things. There's not a real high priority placed on preventative care because out-of-pocket preventative care can be very pricey, particularly when you get into laboratory fees, which can be minimized. Outpatient diagnostic fees can also be minimized as well in these direct primary care practices. But the direct primary care practices, in terms of longevity, it's very difficult to keep up with those because patients come and go, and there's really no loyalty established in direct primary care practices, because usually those practices are not just a one person or one two person group. It's usually a multitude of physicians that are involved. And so some of the feedback that I've gotten is people run into some of the same issues that they have in traditional practices now: longer waits, or crowded waiting rooms, and so on and so forth, lack of doctor availability, because the issue is they're only, taking care of things that come up at a time.
I see. Yeah. So
prevention and wellness.
Yeah. So sort of kind of the acute primary care, or the chronic sort of management of established chronic illnesses, versus sort of looking ahead and having that visionary, that opportunity and that time to spend looking ahead, as you and I, did for me over time. My family history with cardiovascular disease, and sort of let's look ahead, Coop. Let's see what we can dig into here and make sure that we are. So one of the things that Dr. Montgomery and I really emphasized and we pushed back on a little bit is this idea of affordability. We have a culture and a society that we feel like, and I'm sure you do, that healthcare is a right. But we also feel like, as physicians and healthcare providers and professionals, you have to invest in your healthcare. Just as much as you invest in your Gucci and your nice suits and everything, you need to set aside a little money. So I think the point that I want to make, and I hope you will agree with me, Mark, is that this is affordable. You can do this if you make the right choices. And if this is going to become a part of your health plan to invest in your health and personalize healthcare, then you should be able to afford this. Hey, just divert some of that money that you're spending on Gucci and Nike and all this other stuff. No, I got some of that too. But the fact of the matter is we have to think about it and prioritize our health. So just want to, say hello to my friends again here. You're hanging with Dr. Cooper. I really appreciate you all being here. Eric Boyd, my brother from Kansas City, down in Texas now. Thank you, Eric, for always supporting. I went to college together with him here in Kansas City, UMKC. Cleve Taylor, frat brother, chiropractor extraordinaire in Atlanta. I got to get you on Hanging with Dr. Cooper to talk about some chiropractic care. Let's get that set up for June and Men's Health Month. But Mark, so talk a little bit about that affordability factor, because I think some people shy away because, it's going to cost me. Well, you know what? Everything that's worth having in this world does cost you. And if you want to live your best life and be well, then you need to invest in your health. Say something about that for me, Mark.
So that's one of the bigger questions that we get on a regular basis. And that is about, what does it cost? What is the annual membership? And, fortunately, I've had an opportunity to study what those membership fees are across the nation, depending on geography. Here in Atlanta, the membership fee in my practice is $2,000 annually, actually $2,200 annually. And in large part, that is probably one of the lower membership fees that exist here in the country. Conversely, New York, those fees are double, even triple for some of the concierge practices that I know in that area. In California, the same as well. And in a lot of different ways, it can be covered if you have an FSA plan with your insurer. That the FSA plan can be used to cover membership fees. But the actuality is we can also break it up into a lot of different facets. It can be paid, quarterly, biannually, or what have you. And in some cases, we do monthly as well, which makes it a lot more affordable. But when we break it down, and I try not to ever make it about the cost of your care. Right. I think what sells people is the attention to detail that I take, particularly to all of your health issues, the availability, and then just there's the comradeship piece of this as well, that when you have a good relationship with your doctor and you trust him, cost doesn't really become an issue at any point. Right. Because I don't know if you can ever put a value on comfort and knowing that your health needs are going to be taken care of, knowing that when you pick up the phone to call your doctor, you're going to get an appointment. Yeah. 3, that you're going to be able to come into an office and essentially not see anyone else there but, me and my staff, which is essentially one person, and just feel the convenience that, or just knowing that you are the most important person in the room when you are with me.
Yeah.
Because there's no, we don't have to pay attention to anything else. So you're the most important person on the phone that I'm speaking with. Or you're the most important person that I'm texting with, because all of my patients have my personal cell phone number to be able to reach me anytime. Right. Most people know that if you're trying to reach me, obviously during the workday, I'm with patients, but after hours or even when I'm on vacation, patients don't have a problem reaching out to me. And having that availability, I think is very, very important to patients. And I think that's what people really value.
Yeah. Let me ask you this, Mark. There was a question there just to clarify that $2,000 per year, is there a family rate or is it per individual in the family? I know my family is, several of my family members, my kids are part of your practice. Do we pay $2,000 a year per person, or is there a rate for a family?
Yes, there is a family discounted rate. Depending on the numbers of family members, we discount accordingly based on that. So we sort of prorate it 10, 20% based on the numbers of folks that are involved. Adults. Yeah. So dependent family members are covered. In other words, there's no fee for dependent family members. So anyone that has children above the age of, essentially, I see anybody above the age of 12 at this point. Those that are dependent upon their parents' insurance, they're not. There's no fee for dependents, if that makes sense.
Understood. Thank you, Mark. Just want to say hello to everybody out there and hanging with Dr. Cooper Land. I really appreciate you all listening in and participating with us today. My guest is Dr. Marc Harrigan, who is the CEO and the practitioner at Concierge Medicine of Buckhead in Atlanta. Mark, you are taking new patients, aren't you?
I am. As I mentioned, we are not at our maximum.
Okay.
But there is room to join, but we are rapidly approaching about 75% capacity. And it, it's a great story, man, because when I first opened up, man, obviously, I wasn't full at the time. Right. Taking a leap of faith, roughly 2.5 years ago, and the practice has essentially almost tripled since I opened.
Great.
Over the last 2 years. And what was interesting, man, there was an interesting growth period during the pandemic, believe it or not. And the reason being was because there were a lot of people who had grown very, very frustrated by not necessarily hearing from the general medical establishment, but in particular, whoever their previous primary care physician was, because a lot of us were handcuffed and didn't really have an answer for COVID.
Right.
Primarily because, most offices were closed and not allowing patients to come in. Through that time, I was able to conduct not only virtual visits, but be open because we were very, very small and nimble, and we can afford to be open.
Right.
And I was one of the first, doctors in town to have testing in office, both PCR and rapid testing. And it was because of the flexibility of being able to be in a concierge practice that allowed me to do that, whereas larger practices were not able to be as nimble as we were. One of the things that I'll tell you, man, is dealing with patients with COVID throughout this pandemic has been a very interesting thing. I've been able to guide many patients through COVID, both outpatient and those that have had to be hospitalized, and those that needed to be treated outpatient as well. And it's still going, man. This pandemic is not over yet.
Right.
Not only stretch of the imagination.
Let me ask you this, Mark. In a question who came in from Colonel Mays, Kimberly Mays, my colleague from my Army days, asked a question about the process for a new patient. But rather than just general question in that nature is, what's your approach to a new patient? And what should a patient do to prepare to come and see you? I think it's so important. And I tell my patients, write your questions down. That's the one thing I can tell you. Write your questions down. But what else should they do to prepare? And then how do you approach that person the very first time they walk through the door to see you?
So it's kind of a multi-tiered approach, man. Most folks that we bring into the practice, we tend to do a meet and greet, a virtual meet and greet over the phone, just so that and it's a face-to-face, FaceTime virtual meet and greet, Whereas, patient has an opportunity to see me, talk to me, and ask questions. And it allows us to be able to establish a level of rapport prior to making that first visit into the office. As you know, Coop, from many years of practicing, people feel very, very vulnerable when they come into your office for the very first time, and it can be very uncomfortable, and it does not allow people to feel, liberated enough to be able to open up and discuss some of their health issues. And so we sort of get a lot of that out of the way by having a virtual visit first and foremost. And the reason for that is, we need to see if there's a fit. The patient may decide, hey, I might not like Dr. Harrigan. Maybe I don't want to join. And vice versa. I may, I haven't done this, but it has happened in the past. Whereas, you might have, this might not be for the patient. Honestly, it's honest. But that's very, very rare, and I haven't done that all in the last several years. But as a patient comes in, one of the things I ask them to do is to really talk to folks in your family about family illness. By and large, I'm amazed how many people don't know
family history.
Their family history from a medical standpoint. Really, if your parents are still living, really talk to them about, what health challenges they have, because by and large, a lot of things tend to repeat themselves from generation to generation.
Yeah, they do.
High blood pressure, diabetes, elevated cholesterol, and certainly lots of cancers. Those things are important. And then, bringing that sort of information to me is very, very important. But also just have an honest conversation about lifestyle, right? What is it that you do for a living? How well are you taking care of yourself from a diet and exercise perspective? And being honest about it, because the only way I'm going to be able to help anyone is if you tell me everything and lay it out on the table. Because the more I know, the more I am better equipped to be able to assist with every aspect of it. And it's not just about, the traditional medicine things as well, man. It's also about where are you psychologically? That's important.
Yes.
Important.
Yeah.
How well do you sleep? How are you getting along with your significant other, if one exists? How do you get along with your kids? Those kinds of things. What are your professional challenges if you have any?
Mm-hmm.
Have you had challenges in the past with, ascending the corporate ladder? And why that may be an issue. And a lot of it sometimes goes back to, some of your physical health, but also your psychological health. And so we take sort of a 360 approach to the global approach to the patient to be able to truly understand, how do I really help folks? Because believe it or not, those are the struggles that people have that oftentimes don't get discussed in a 15-minute visit.
That's right. Yeah, that's it. That's the reality of it. And, one of the other things, Mark, I will just mention that I think is very important. I always tell patients to do this. And this is something that's everybody right now today, essentially in all of medicine, has access to. And that's electronic access to your records. Right. Get on those. And as a result of some of the things that were implemented under the Affordable Care Act, meaningful use, you have access and you have the right to have access electronically to your records. Go in there, figure out how you navigate that, what's in there, because if you change and move to another system or another doctor or something, it's going to be very, very important. You come to the hospital in the middle of the night, there may be something in those records that you can pull up right there on your phone that you can show to an emergency room physician. So engage on those levels with your patients. Let me just say hello one more time here. Yeah, Jimmy Dorman asked a question about concierge doctors coming to the hospital. Most ambulatory care, private practice doctors, Jimmy, unfortunately no longer go to the hospital. We have hospitalists that are in-house. Marc Harrigan does, I know, but not a lot do. So Marc Harrigan is unusual in that regard because of the way his practice is set up. He can do that, and that's one of the advantages in his case to being able to do that. So let's transition here a little bit more to some of those things. You talked a little bit about COVID. Early on, kind of summer, and then now, what's happening with COVID now from your perspective? What's going to happen this summer and beyond with COVID?
So I'll tell you, man, COVID, the numbers are coming down. Everyone can see that. I think if we remain vigilant with mask wearing, in the appropriate settings, obviously. But more importantly, getting vaccinated is really going to help us, beat this pandemic. So, I'll just speak briefly about where we are right now and where we've come from. Last year, this time, man, we were, I think, 1 or 2 weeks into a national shutdown.
Right. Yeah.
And with no answers in terms of how we were going to deal with this, other than staying in the house and ordering food and liquor. There have been some very interesting habits that
TikTok videos
and even friends and family throughout this pandemic, in terms of folks that become much better bartenders and cooks. So it's been interesting. But from a healthcare perspective, we have really developed quite rapidly in terms of approaches to COVID and how we manage it. I'll just speak briefly on the monoclonal antibody treatments that are available to treat symptomatic patients with COVID. And this came about roughly within the last 6 months. The availability of being able to utilize these treatments. And for those who don't know, monoclonal antibodies are essentially an interventional treatment that's done via IV in a hospital setting, an outpatient hospital setting, for those that have COVID symptoms. It is designed ideally to create antibodies to COVID and cut down on the symptomology or the severity of the symptoms and prevent hospitalizations. And we have been able to utilize that technology roughly and more freely since December. I've probably myself utilized it on at least 25 to 30 patients over the last 2 to 3 months in terms of being able to keep people out of the hospital and manage their complications. I can honestly say that in my patient practice, I have had no one patient die from COVID that I can think of. And I know all my patients, and the only other person who died was died by natural causes and not COVID related. I've had 3 patients in that almost 300 population that have been hospitalized, and I would say roughly 25 to 30% of my patient population have been affected by COVID or infected with COVID one way or the other.
Mm-hmm. Got it. This is interesting. It's an interesting time for us because we are rapidly, I hope, approaching the concept of herd immunity through vaccination, and I think it's going to be especially important to follow, in my opinion, what's going to happen 6-8 months now around that Christmas time, when, if we think about the way that vaccines work for viruses like this, the antibody burden starts to drop. Are we going to now? And I heard the president say several weeks ago that Christmas may be normal this year. I'm like, okay, all right, well, let's see. We will see about that. So that's going to be something that's going to be very, very interesting to see going forward. What are your thoughts about that, Mark, the fall and beyond with COVID?
So I agree with you. I think the way to achieve, true herd immunity, if you really understand the definition, is going to be through vaccination. I think we're on a good pathway right now. Whereas if most of the folks in the country get vaccinated, we're going to need to do a lot more education about the benefits of vaccination, because, as you know, there are folks out there who right now are making a political stand about the disease of COVID in and of itself, and whether or not to get vaccination, which I completely disagree with. This is not a political issue. This is a public health issue, whereas we need to do a better job of taking care of one another, regardless of political affiliation or how you feel about this person or that person. But that said, where COVID is, we were warned about COVID several years ago. And I listen, I tell people this story all the time.
Yeah.
We were warned about this several years ago. I want to say 2014, and then again in 2016.
Yep.
That this was coming, and people forget about the previous pandemics that almost hit the U.S. that didn't hit the U.S., and that was MERS and SARS-1. Yep. And it never happened. primarily because we got in front of it, we were prepared, and even the Ebola pandemic almost hit America. Right. And that never happened because we were prepared. That said, COVID is here, and COVID is going to be here to stay. And what I mean by that, it's going to become an endemic disease. And the difference between pandemic and endemic is this is something that we're going to have to deal with on an annual
going forward.
Going forward. So what that means is look forward to having to get a COVID vaccination on an annual basis. That's going to be the normalcy of Christmas, if I think the President Biden is talking about. And so you're going to have to start factoring that in along with an annual flu shot. And again, nothing is 100% guaranteed to cut down on the virus, but it will significantly reduce the chances of complications from the virus, which is why we have over 500,000 people gone from us now. Complications.
Got it. Understood. So you all are hanging with Dr. Cooper. I really appreciate you. You all don't know how this makes me feel. This is an opportunity for me to fulfill my passion, which is getting information out there, helping people transform their lives. Marc, you're a top doc. Tell us why you're a top doc, my brother.
Man, I don't know, man. Honestly, I think it may have just something to do with just the attention to detail, man, and how seriously I take it. Mm-hmm. And, just the fact that, I talk to people like they're people. I don't talk at people. I don't talk down to people. And I'm talking about patients. I try to make everything as understandable and relatable as possible. Mm-hmm. And, at the end of the day, I'm just as human as the next person.
Understood.
And I think being able to share that with folks and have that emanate from you, I think is important. For any physician, really, it really is important for any physician. I think that's probably why I've had the loyalty from the patients that I've had over the years. Mm-hmm. I'm thankful for it, and I think a lot of that comes from my upbringing, my family. My mom and dad still are very just extremely personable folks, and I think a lot of that is rubbed off on me.
And I must say that you and I both are going to get kicked if we don't mention that the illustrious, the beautiful, the queen is in the crowd. The queen, my queen, Akima Howard Harrigan. Thank you, Dr. Harrigan, for joining us. That's Marc's wife. If you all don't know, who I know has a significant part in your. Oh my goodness, there's my Cameron, my daughter, my baby girl, and Marc's one of Marc's patients, Cameron Cooper.
Cameron.
Hey, what's up, CC? Joining Daddy on Hanging with Dr. Cooper. I really appreciate that. So, Marc, we're gonna wrap up now. Any parting shots? Anything you want? I know you got to get to the boys. We got baseball today. Any parting shots? Anything you really want our audience to know? Tell us how they can contact you. They can connect with you, and sort of, and if they want to join your practice.
Sure. So. I have a website. It is, I'm not sure if you can put that in the chat at all.
Tashana, go ahead and put his website. He's getting ready to tell us what that is right now. Tashana, if you can type that in for me.
It is Marc Harrigan, Marc with a C, Harrigan, Harrigan, MD, as in MD, medical doctor MarcHarriganMD.com.
www.markharriganmd.com, Marc with a C. Marc, I want to thank you so much, my brother. Love you, man. I appreciate your time and your energy and your passion. And to all of you out there, I really appreciate y'all. Remember that today is the best day of your life. Yesterday is gone. Tomorrow is not promised. Live it, love it, be well. We'll see you next time on Hanging with Dr. Cooper. Take care.